Welcome to our discussion on the impact of generative AI on occupational therapy. Today, we will start by giving you a brief introduction, then move on to the role of OT, benefits of AI for OT, challenges we may face, potential future development, then end with a conclusion. Introduction. First, let's understand what generative AI is. Generative AI is a subset of artificial intelligence that leverage machine learning model to produce content. This could be anything from text, images, voice, and even virtual environments. Training AI is like teaching a child to draw a cat. You'll show him or her a few pictures of cats, then point out some major features of cats, such as whiskers. After seeing enough examples, the child will start drawing their own version of cats. AI does this by using complex algorithms and models, the most common one being generative adversarial network. Many people may wrongly consider that AI is only for fun, or can only perform easy tasks such as writing emails. However, according to statistics of 2023, AI is actually broadly used in different professions. Even with the healthcare profession, which may be considered to be more serious and rigid, there are still 15% of respondents. Let's first talk about the roles of occupational therapists. Occupational therapist is a health profession that helps people of all ages to participate in the activities and tasks they need to do or want to do, but are prevented from doing as a result of physical or mental illness, disabilities, or aging process. This is achieved through therapeutic use of everyday activities, also known as occupations. The importance of their work lies in enabling individuals to live independently and having a better quality of life. Occupational therapists work within a variety of patients, ranging from children with developmental disorders to old adults with cognitive decline. For challenges faced by occupational therapists, high workload, communication, and limited resources are three of the examples. With a high caseload, it's easy for them to feel emotionally stressed. Also, it's common that they have to communicate with other medical professionals, different patients, and their families. How to make use of limited resources for the best course of treatment is also another challenge.
Let's move to the next topic, which is the benefits of generative AI for occupational therapists. First, generative AI can be used as a tool that helps occupational therapists to record and organize data. It is very convenient for generative AI to record and organize thousands of clients' data by just entering the unsorted medical record. It can classify and summarize the case according to age, gender, type of disease, and so on. This can reduce the workload of occupational therapists and allow them to address more complex needs. Second, generative AI can take part in creating virtual reality environments. Generative AI can create personalized virtual environments based on the specific need and preference of the patients. Here is an example. The generative AI can generate different scenarios and characters that allow children with autism to interact and chat with it. It can help them to practice the social skills. At the same time, the generative AI can record the therapy and the interaction, which allow occupational therapists to analyze data and address the treatment, making it become more suitable for their patient. Third, generative AI can become a virtual consultant. It can analyze patients' data and give suggestions based on their medical history and existing medical literature. It can also help therapists to tailor their treatment. This makes therapy more convenient and effective. Fourth, generative AI can manage the insurance and payment for patients. It can summarize the insurance that covers patients' issues to the consumer. It can also develop the documentation and generate electronic records that cover all the payments of the services and products for payers.
Next, I will talk about some potential challenges we may face if we use AI to assist occupational therapy. Firstly, let's talk about data privacy. Generative AI systems require large amounts of data for training. In the context of OT, this data often includes sensitive patients' information. When feeding this data into the AI system, it could potentially provide opportunities for hackers to steal this information. Therefore, robust security measures are crucial to protect patients' data. Secondly, there's the issue of technical training. Many occupational therapists were trained at a time when AI was not as prevalent as it is now. They may lack the technical knowledge to use generative AI systems effectively. They would need training to understand how to use these systems, interpret their outputs, and integrate them into their practice. Some therapists may even resist learning these techniques, believing that they can perform their job well without AI. Thirdly, there's the risk of dependence on technology. Therapists may become overly reliant on the AI system, using it as a crutch rather than a tool. This could lead to a decrease in the quality of care if the AI system makes a mistake or if the therapists stop using their professional judgments. Next, we have the concern of AI replacing human therapists. Some clinics or hospitals may consider using AI to replace some therapists due to the cost considerations. However, human therapists provide a level of empathy, understanding, and personal interaction that AI cannot replicate. This is particularly important for children and those with psychiatric illness who need understanding more than just a therapy plan. Liability is another concern. If an AI system makes a mistake that harms a patient, it is unclear that who would be held responsible, the programmer or the therapist. This raises complex legal and ethical questions that need to be addressed.
Now, let's move on to some potential future development that could revolutionize the field. In fact, some are similar to what Part 3 has mentioned. However, I will focus on these two areas. Firstly, advanced personalized therapy can be adopted. AI could be used to create highly personalized therapy plans, taking into account a patient's unique needs, abilities, and progress. This could improve the effectiveness of therapy and speed up recovery times. Let's say an occupational therapist is working with a patient recovering from a stroke. The patient has limited mobility in their right hand. The therapist could input the patient's data into a generative AI system. The system could then analyze this data and generate a personalized treatment plan, including specific exercise and goals tailored to the patient's needs and abilities. And the other one is predictive analysis. AI could be used to predict a patient's progress and potential challenges they may face in the future. Here are some other possible strategies for OT to use AI. And in the final part, we will explain some of the use of GenAI in order to finish this presentation. Firstly, our group had decided the topic to work on, which is topic 2. Next, we had asked GenAI to help generate an outline for the topic of how AI can help OT as we are occupational therapist students. And the prompt is like this. The outline of GenAI gave includes introduction, explanation of GenAI, how GenAI helps OT, potential challenges, and ethical considerations. There are questions as guidance for each part, and the details can be further elaborated by us. Also, some parts of the script are actually mainly generated by generative AI, and the prompt is like this. It is to be noted that some changes to the script were done by us.
Next, I'll be responsible for the reflection part. Our first reflection is that AI is really useful in helping humans. It provides sufficient information promptly, which helps us finish the presentation effectively. The second reflection is that no matter how much we try to improve the prompt, we'll still need to modify the message generated by Gen AI. The results may be too general, too precise, too little, or even too much.
Next, I will talk about some difficulties when we use AI to assist us to finish these assignments. Firstly, the information provided by AI is too general. When we ask for some ideas from AI, the explanations of each point are not so specific. Therefore, we need to further elaborate so that the audience can understand our content. Secondly, when we ask AI to generate a script, it does not really generate a script, but like when we use AI to ask Bing Chat to help us to generate a script, it generates it by only adding a greeting to the output. But when we turn to ChatGPT, it finally generates a good script. And also, the guideline given by AI is not so reasonable. It generates some guidelines that the time limit is impossible to finish. Therefore, we need to adjust the time and cut some of the content so we can finish our presentation.
By using generative AI in this project, we have a deeper understanding about it. First, the generative AI is particularly useful in brainstorming sessions, as it can generate many ideas and allowing us to explore different directions, like it can help us to decide the outline of our presentation. This can enhance our creativity and productivity. Second, generative AI can be trained by our prompt, like feeding it with various types of data. Generative AI can analyze the patterns and information provided in the input and generate more accurate answers.
And we are positive and looking forward to the use of AI to help OT field in the future. And this comes to the end of our presentation. Thank you.